Okay, I'm gonna go ahead and get settled. I know we've still got some people, or excuse me, started. I know we've got some people still trickling in, and I just want to make sure that we're getting as much conversation in as we can. We've got three really great panelists here today. My name is Julia Cunningham. I'm a senior policy analyst here at the Hunt Institute, and I'm thrilled that we are welcoming Dr. Barbara Jenkins from Orange County Public Schools in Florida, Linda Jacobson, who is a senior writer with the 74 Million, and Dr. Matthew Bloomstead, who is the Commissioner of Education in Nebraska. And so the three of them are here today to speak with us about K-12 schools and vaccine distribution. This was a topic that when we originally came up with this discussion, it was pre-vaccines being so widely available to all adults. And so we were anticipating that this would be much more focused around how can schools and communities support in getting adults vaccinated and ensuring that everyone is getting equitable access. However, as we all know, that situation has changed drastically since we came up with this conversation. And so today we really want to think about what will it look like moving forward as the vaccine is becoming more widely available to everyone, not just adults, and what role can states and schools play in supporting all people who want to receive a vaccination, and making sure that there is equitable access and that all of our resources are being pooled efficiently. So that's what we're going to focus on today. And as you know, everyone has just adjusted so rapidly over the last year plus, and we've seen really great innovations. We've seen really great partnerships arise. And I think this is an opportunity for us to think about, yes, how can we help students get vaccinations right now? How can we help people get equitable access to health resources right now through our K-12 institutions? But also, how can we make sure that these partnerships and these infrastructures exist moving forward so that if this situation or a similar situation arises again, we're not creating the systems from scratch, and we're not having to start these discussions all over again. So just wanted to set that tone as we go into the conversation today and really think about how do we approach this from a whole community perspective. With that, I'm going to stop talking and really kind of get started on our conversation. Like I said, we have three really great panelists who are going to speak from a national, state, and local perspective about some of these discussions, and I want to give them excuse me, as much time as possible to speak. One quick note before, if you want to follow along on social media, please feel free, if we could go to the next slide, there we go, to follow along using the hashtag #EdHomeroom. And there will be conversations happening there, and please feel free to jump in with your thoughts. Lastly, if you have any questions, we won't be unmuting lines today just because there are quite a few of you and it can get a little chaotic. So if you have questions, which we will have plenty of time to get to at the end, please feel free to submit them into the Q&A and we will devote about half of today's time to getting those answered. So with that, I would like to turn it over to Linda Jacobson. And like I mentioned, Linda is a senior writer with the 74 Million, and the 74 Million has been doing a lot of really important reporting on some of these vaccine conversations that are happening nationally. So Linda, I was wondering if you could discuss from a national perspective what schools are doing, what they've done, and how they're continuing to support vaccine distribution within their communities, and what are some of these conversations that are happening as it becomes more likely that adolescents will more widely receive vaccinations.
Yeah, thanks so much. I mean, Julia's right. When I was invited to be part of this, I mean, teachers were just barely beginning to get vaccinated, and states were just beginning to add teachers to their priority lists. And I think, you know, as of last week, I think the White House said about 63% of adults have now been fully vaccinated. And if you add in 12-year-olds, I think by the end of May, it was about 60% over age 12 that had their at least their first shot. You know, what I've seen so far is districts take, you know, two very different approaches to this. You know, I was thinking about, you know, Chicago, where the teachers union there really pushed for the district to have a very active role in getting teenagers, when it was just 16 and up, eligible for the vaccine, getting teenagers vaccinated. And the union wants to see specific goals, like, by this date, we'll have this percentage of teens vaccinated. And now with, 12 and up, similar targets that they want to see. The district, on the other hand, just has a website saying, here's where you can go. As far as I know, they haven't had any sort of on-site, vaccination efforts. And then I sort of contrast that with Los Angeles, which, has identified, over a 2-week period, 250 high schools where they're going to do on-site, vaccinations, and, big push to get the word out to families. And, I think that, it's, with summer now here, I think that's going to be a big question, is what happens with vaccination rates over the summer. I saw that there's, health departments that are planning sort of mobile units that'll go out into communities, working with schools to get the word out about that. I know there's some, charter schools in New Orleans that are planning summer school, vaccination efforts, and, wanting to make sure that they start, on day one of summer school, so they can get the second shot in, before summer school winds up. So, I think, watching the trends in vaccines over the summer will be something to keep track on, but I think, there's definitely going to be some creative approaches out there. I think for the fall, nobody knows what mask mandates are going to look like, by then. But I think schools will, continue, if masks are still, being required in some places. I think there's going to be, challenges over, some kids and families pushing back, saying, well, why do I have to wear a mask here, but not when I'm in school, or not when I'm out of school. So those will, depending on where that all stands, I think, how schools handle vaccinated versus unvaccinated kids, is might create some challenges. So I'll be interested in hearing, what's going on, and, what you're planning in Orange County is, et cetera. So thanks so much.
Yeah, thank you. And I think it has been really interesting to see how different districts have reacted, even districts with maybe similar contexts, and having their procedures be completely different from each other. So I think that'll be really interesting to see how that plays out. On that note, I think that transitions us very nicely into Dr. Jenkins from Orange County Public Schools. And Dr. Jenkins, I was hoping you could talk a bit about what you all have been doing in your district, and what challenges you're anticipating as you move forward.
Sure. Thank you, Judy, for that question, and certainly honored to be on the panel with my esteemed colleagues. And thanks to the Hunt Institute as well for hosting such noteworthy topics for the community at large. So a couple of things come to mind, and I do want to talk about Linda's question on masks, but let me just give you a bit of a backdrop. So in Orange County, and throughout the state actually, we were under mandate, unlike Chicago. I know the superintendent there who is ending her time there. We had a mandate at the state level that schools would be open face-to-face. If you wanted your full funding, you had to have some mechanism in place that parents at least had a choice. And so in Orange County, we went from about 30% coming face-to-face and the other 70% at home for their instruction, to flipping that to about 75, 80% face-to-face and the other percent at home doing their instruction, as people became more and more comfortable that we had mechanisms in place to try to keep our children safe. Let it be known, we had lots of COVID cases that had to be contact traced and had to be dealt with, but there was not a proven transmission that was happening at the school level. It was community level. So the community gained some confidence there. Part of the confidence, Linda, was because we did actually have a mask mandate by board policy that said children and adults and employees were going to wear a mask. And we negotiated with our union that said we will limit visitors. We're not going to let other people come on campus, period. And those that are on campus have to have masks on. So that was by board policy. So we are in the throes, as I speak, of unraveling some of that policy to make masks voluntary for next year because the vaccine is now available. So in Orange County, we have had great partnerships with our local Florida Department of Health here in Orange County, organizations that have helped us, including Health Heroes, and the other one is called MedStop Pharmacy. Those kind of partnerships, we've begun hosting those vaccine clinics in our schools. First, we started when the governor made it available. We made it available to employees. Hundreds of our employees actually took the vaccine when it became available. And then with our students, we had an 18-year-old get on camera, parent permission, of course, but got on camera and took his shot. We pushed it out on social media. We started trying to encourage our young people to get those shots. To date, we have an additional 21 clinics planned over the summer between middle schools and high schools. We've got 44,000 children in summer school. And so we're hoping to leverage that. If your parent signs a form, they don't actually have to be at school with you. We can give you the shot because you brought the form in like we would do with any other immunization. But to date, I have to tell you, as much as we have a website we've launched, we have a medical advisory committee that has tried to do myth busting, because everyone seems to have some expertise because they research it on the internet, and sometimes there's information that's inaccurate. And so we had a medical advisory panel. We actually recorded it. Anyone can watch it to talk about Ask Mac, Medical Advisory Committee. And over 730 questions were submitted. And so we found where the trends were and let them answer live broadcast on YouTube, and then put it out on social media in a recording as well, to try to help bust some of the myths and the fear around actually getting the COVID vaccine. So we've been pushing it out there, but to date, we probably had about 3,700 first and second doses. We are not allowed to track students or to ask them to give us their information. The health department can do that. But even if the 3,700 were all students, that's only about 2.5% of our middle and high schoolers. So the word has to get out there, the encouragement has to get out there, and there has to be a campaign. And frankly, we are looking at additional incentives, as some of my peers have done across the country, lotteries where there are door prizes or gift cards. One organization is offering small scholarships. You can get your name into the basket to be drawn for scholarships. I think we're going to have significant additional campaigning between now and the start of school to get more of our children vaccinated. And certainly when school starts, we need to continue that campaign as well. Because if we make face masks optional, it's on an honor system. Our governor refuses to have anybody be required to give proof that they've had the vaccine, including cruise lines, if you hadn't heard that. And so essentially, we are going to have to go on a matter of faith that people will take advantage of it as we keep growing those numbers. And then we will simply say it is a parent's decision, but your child will be exposed if they haven't been vaccinated. But it is your decision. We acknowledge that. So very hopeful that we'll have more vaccines, but the work has just begun. There's so many more that need to be vaccinated to help us with that herd immunity within the school system.
Thank you so much, Dr. Jenkins. And you bring up a really great point about student privacy and student information there. So I think that's hopefully something we can get into a little bit later as well. But would like to now turn it over to Commissioner Blumstead, excuse me. We just had this conversation right before. Commissioner Blumstead from Nebraska. And Commissioner, I was hoping you could similarly talk a little bit about what you all have been doing in Nebraska, particularly at the state level, and what are some of the challenges you've encountered or anticipate encountering.
Yeah, and it's again really great to be on with this group, and thanks to both Linda and Dr. Jenkins for insights. One of the things I think from a statewide level that has been critical for us is really understanding what our schools needed at given moments in time, and the challenges that they're facing across the state, from our smallest of our school districts to our largest. And so we didn't have mandates to be back in school, actually in person, Yet most of our schools went back in person right away. And we had just our largest school district, Omaha Public Schools, actually delayed for the first quarter before they started back in person. And we experienced very similar to what I think Dr. Jenkins talked about, that we didn't see necessarily a lot of spread, but there was a lot of contact tracing and a lot of need to really work with families and public health at a local level, at a state level as well. And what we experienced was a pretty good opening of the school year. And then we saw case counts go, through a peak starting in mid-October and into December. That was pretty drastic. And I, quite frankly, didn't know how we were going to get through it. But at that point in time, we also started a campaign largely around masking and social distancing and the need in the community, because we thought that we were seeing very much the trend that community spread was impacting our ability to remain in school. And so our schools really asked that we help lead a campaign, and we called it Do Right Right Now, and had a campaign statewide. In fact, it's still going on. But from the beginning, we recognized that vaccines were likely coming. We kept hearing, hey, look, they're likely to be here. And so we started the campaign not just around masking and community, kind of that responsibility side for individuals to think about, do right now, and how can we continue that message. So we've actually done that and largely switched to the vaccination side with, again, targeted messages to parents and families and communities. And like many, I think folks probably, getting local influencers, so to say, to be able to emphasize that particular work. And I think that's been helpful at some level of scale around that particular messaging. But I think most important has been what's happening at a school level, in the school and district level, relative to the conversations that they're having with parents and families about the importance of vaccination. And we are very much in this mode of how do you balance what really, I think, all of the non-pharmaceutical interventions, mask wearing, distancing, with people's desire to get back, to quote unquote normal, whatever that might be for us. And so as we balance that out, I think going into the summer, we're really excited certainly we're very excited to see 12-year-olds and up now eligible for vaccine. Schools actually, before it was the 12-year-olds, when it was 16 and up, they were actually offering to their juniors and seniors, primarily, that would be the right age group, kind of the end of the year, make sure you get your vaccine, and made it available in many of our schools. And again, that wasn't so much coming from a state level as it was in that partnership that really developed between local public health and our school districts. And I think the other big thing for us from a vaccine perspective, now that we have 12-year-olds up, and hoping, eventually that we'll see that age range even broaden a little bit further, that we want to make sure that we're kind of leading with that notion of, hey, look, they're safe and they're effective, and making sure that there's that engagement. I would say we're really now starting to turn our attention to pediatricians and family practitioners as partners in the conversation. We've had a lot of nonprofits, a lot of community partners be involved in messaging. But as I talk to schools and work with schools, it's like, who else, really needs to be at the table? And I don't know what other states' distribution models look like, but actually our doctors weren't very involved in vaccine distribution. Those general practitioners, those pediatricians, until recently, really haven't had access to the vaccine in the same way. And so I think that's going to start to turn the tide as far as conversations with parents and families. We're still very worried about our historically marginalized populations that don't have regular access to healthcare. And so I really see our schools' role and our public health role being tied to that type of messaging, and working with a lot of folks in that arena. And I'll just lastly add, in fact, I just came off a phone call with their chancellor of the University of Nebraska Medical Center. We have a global health security center that actually received the very first COVID patients in the nation from Diamond Princess, right? They actually came to Nebraska to be quarantined, which is an unusual thing, that folks are coming all the way into the middle of the state. But we have some experts on that. We're actually, in addition to vaccines, really having to think about what the testing strategy is going forward, and this whole sense of the strategy is we really want to keep schools open in this. So we're vested at every level of the conversation, and appreciate being with you today.
Thanks so much. And you hit on a lot of points that I hope that we can get into a bit more in the discussion. And now I'm really happy to turn it over to our Q&A. We've already gotten a few sent into the chat that are really great questions, and I'm excited to get to them. And if anyone else has any, please feel free to submit them into the Q&A, and we will be spending most of the rest of the time getting them answered and hopefully having a pretty open discussion about some of these issues that have been brought up. So Linda, I'd like to start with you, and I know this has been touched upon a little bit with everyone's remarks, but thinking about the coordination that needs to happen between the different sectors and the different levels that are involved with these partnerships. So looking at districts, local governments, states, private partners, public partners, whoever it might be, as it relates to distribution, what are some of the challenges that come with this, and how are we seeing these different entities respond to those challenges?
Well, like Dr. Jenkins said, I think a lot of districts by now have pretty good relationships with their local health departments. So they're already, they already have a head start on, if they want to have on-site vaccination efforts, they've got those channels to kind of set that up. I think then the next big layer that they need to focus on is the consent process. I mean, like she said, the advantage of doing this at school is that, and during the school hours, is that, parents don't have to be there. I think one possibility is that when the shots are available for younger ages, parents might want to be there. So there's considerations around, especially if school is in session or you've got summer school things going on, just space considerations and where are you going to have this taking place if school's also in session, and if kids are eating lunch, where, what space are you going to use for the kids who are getting the shot to go sit and wait for a while, and, just the flow of traffic, I guess, throughout the day, if shots are happening at school. Volunteers, where do schools normally go for volunteers to kind of handle some of those logistics? I think, they both talked about sort of hesitancy among some populations around the vaccine, working with sort of parent liaisons and, parent leaders. I've seen some polling that, the reaction to this vaccine for kids is a little different than other vaccine, opposition. It's not a general opposition. It's more about, is it necessary? Why that if kids were not at high risk to begin with, some people just have thought this wasn't, why add the vaccine if they don't really need it? I think there's still some doubt out there about that. I think, some of the other issues that both the commissioner and Dr. Jenkins mentioned is about testing going forward. How long will schools need to continue to test for COVID, once vaccines are widely adopted? So those are some of the things that I'm sort of keeping track of, going forward.
Yeah, thank you. And I think you kind of provided us with a great lead into our next question for Dr. Jenkins. Dr. Jenkins, communities of color are very justifiably more vaccine hesitant and mistrust the medical community for very valid reasons and for very real historical injustices. So how can states and districts earn trust with Black, Brown, and Indigenous communities to really ensure this equitable transition back into school buildings and really address parent concerns?
That's an excellent question. We've got a couple of initiatives going here that seem to be gaining some traction. And you're absolutely right. It is obvious that underserved populations for healthcare in general are also going to be hesitant around this vaccine because there's so many myths and so many stories out there about what the vaccine is and is not. So what we tried to do again is to use our medical advisory panel. They are pediatricians, pediatric pulmonary specialists, internal medicine, infectious disease. I mean, such an impressive resume of those 9 individuals that serve on the panel. And so we try to use their expertise, and they are of all races, a couple African-American, Asian, white. It's just a good mix, Latinx as well. And so we try to make sure their actual opinions are pushed out for folks to be able to see. And when they say things like, I've gotten the vaccine, my children have the vaccine, as soon as they have it for my younger children, they will have the vaccine. I think that's helpful. We've also engaged our Interfaith Council. We have a group that from all different religions, all different houses of faith, ask them to help initiate campaigns and informational meetings, and to share the social media feeds with that panel presentation, because we believe they will trust their faith house leaders as well. And then when it comes to the local school, our health department realized that the big convention center vaccine sites were starting to dry up. They weren't having as many turnouts, so they've started to break down into smaller segments in the community, at a community center, at a recreational facility, at an elementary school. People tend to be more trusting, and our numbers were, when we started our individual, we've got 21 more scheduled, but we've done about a dozen. And in each of those instances, the numbers have exceeded anything large scale in the surrounding community. So bringing it to the local community, I believe, is critical. It's also helpful when they see their principal. Our parents tend to trust their principal more so than they would strangers. So when they see their principal at the site and encouraging them, the numbers have been impressive as well. And I think short of an informational campaign and a social media campaign that counteracts some of the misinformation that is out there, and folks getting their shot and saying, we have buttons that say, I got my shot. I have my vaccine. I forgot to put it on this morning. But we have buttons that individuals are wearing that says, I got my shot. And to help spread the word that way, I think is just critical for underserved communities as well. But I want to be clear. We have some educated and widely served communities that are still somewhat mistrusting of the vaccine. And unfortunately, sometimes it seems political in nature, that we shouldn't be encouraging, that they've done their own research. That can be debunked, of course, but they've done their own research and there's no need for it. And people tie the mask wearing campaign with the vaccine. Don't tell me I need to get a vaccine in order not to wear a mask because it's my choice and it's my right. And on it goes. I think the only way to counter that is to keep pushing out the facts, and hopefully with reputable experts that will share that information, and individuals that they are familiar with that can share the information as well. That's been our strategy. And social media is where everyone lives. Gonna do their own research on the internet, so we push out information in social media as well.
Yeah, thank you. And that's such a great point about the community-based clinics. And I hope that a lot of communities start to adopt that, because it really is true that, especially in rural communities, the educational institution is just such an important part of the community, and can really be effective and an effective lever there. Commissioner, something we haven't touched on as much today is ESSER funding and federal relief funding, the multiple rounds that we've seen over the last year, and how they're such a crucial part of for states and districts as they're developing their plans for next year. So how is Nebraska thinking about this federal relief fund, these federal relief funds, and what are some of your state's priorities when it comes to using this money, particularly in regards to health supports and vaccine distribution and PPE and some of the other more kind of practical uses that we're hearing about?
Yeah, and again, it's certainly been a effort that starts and builds, I think, over time in the relationships that have been built with public health and our private kind of sector partnerships and things along those lines. When the last March, when the pandemic first started to hit, we convened groups of our nonprofit partners, and one of our nonprofit partners was just great in helping lead the efforts overall, but it's our Nebraska Children and Families Foundation, with a real focus on community services, especially to underserved communities. And so we actually were in food, diapers, a lot of things early on where there were supply chain breaks in certain communities all over the state, to make sure that we could find resources that were going to help those communities. Our EL populations as well that needed additional input or additional opportunity to learn about that, our translation, all these things that were taking place across multiple partners. And so we've actually maintained that and built that as kind of our core strategy on communication into communities that otherwise maybe would be left out of the conversation. And so it's been really important to build that type of partnership as we go. A lot of our ESSER funds now, as far as trying to serve from a behavioral or from a mental health standpoint, from a like we talked about, historically marginalized communities that don't have normal access to public health or to health care provision in the same way, really building partnerships to say, how do we encourage to keep doing that? Our before and after school programs, are actually one of the greatest places for us to connect with parents from a statewide perspective in particular, but even at a school level, because there's such a faith and trust in those relationships that have already been built. And so we're really trying, I'll call it connecting the dots, right, between a lot of different partners that are extremely important. And we're actually using our ESSER funds to continue those efforts where we've set out, kind of key areas of work, ensuring that the communication continues between public health and our school districts, because we've actually learned, or feel anyway, that the relationship between actors in this moment in time has been what's helped us most. And so we've looked at how we can fund public health liaisons between our public health officials and our school districts. When you mentioned really small communities, I mean, we have very, very small communities that their access to a hospital may be 100 miles away. And literally having to think differently about how we ensure that vaccine distribution takes place at that most local level, as well as building a trusting relationship with all of the partners. And there's a real need, I think, for us in the long run. This is probably not a moment in time that any of us are seem to forget, but I will tell you that the relationships that are being built are actually going to help us in the long run, not just around vaccine distribution, but health and access to healthcare, access to the role of healthcare in schools. I think will start to change. We had legislation that was dealing with mental health and well-being in community kind of school settings, which in some parts of the state is really easy, in other parts of the state is really difficult. And so again, we're just learning and figuring out how we can provide scale at a statewide level that helps our schools, help their communities, and then in places where we can be a first line of assistance, we're able to help organize that as well.
Thank you. And you actually kind of touched a little bit on the question that I was about to ask. And this is a question that was submitted from Kenya Haynes. And she is curious, and I'd love to hear from all three of you on this, but I'll start with Dr. Jenkins. And how have schools been supporting unaccompanied homeless youth, or I'm kind of adding on here of my own curiosity, undocumented students, or students who maybe don't have the parental support that might be needed to get vaccine access. How can schools support those students? So I'll start with Dr. Jenkins, but would love to hear from both Linda and the commissioner on this one.
So in Florida, and certainly in Orange County, we have a very international community. For undocumented and unaccompanied, though, those numbers are not anywhere near what other communities may be experiencing. So in Central Florida, we have partnership with the foster care organization. If there were an unaccompanied youth without a parent, then the foster care organization would bring that individual, that young person, under their care, and then there would be a designee who could then give permission for the vaccination. So we have a very strong partnership with our foster care organization here in Central Florida.
Thank you. Yeah.
And I might just add that as we've done some work, in fact, there's an additional effort going on. It was more around right now around testing in migrant worker populations and assisting, and also addressing certain populations. But when you ask about the homeless in particular, right? I mean, a lot of the relationships that have to be in place, the the chances to do that. We have really great homeless coordinators across the state that have really stepped up to understand that population being served. We had flooding in 2019 that was pretty widespread in Nebraska and impacted a lot of folks. And little did I know in 2019, by 2020, we'd be dealing with additional challenges, but we learned some things in that moment, and in particular, understanding better what our homeless needs were. At least I became more aware of how we could be helpful at a state level, and we've kind of implemented some of those dynamics as well. But like all of our what we call systems involved youth, so foster care, juvenile justice, really understanding the authorities and where they're at and who has the right to kind of assist and make those decisions is really important to schools as they're being served. And so we continue to kind of have a real important dialogue about how to best serve students around that. Again, a lot of our nonprofit partners are actually very connected to those communities as well. And so all those things have come together to try to address that issue.
I was just going to mention that the American Rescue Plan, the most recent relief bill, included $800 million for states to focus on homeless students, and to not only attendance issues, but it's a pretty flexible amount of money for states to address any needs that are keeping homeless students from being fully involved in school. And I imagine vaccination efforts among that population as well is an area where that could go. I think it's about coordinating with the community, like everybody said. And so I would see that as being one route as well that could support those students.
Yeah,
Or messages getting out to them. Yeah.
Yeah, no, thank you. That's really helpful context. And another question, and I know this has been coming up a lot. We got this question pre-submitted a lot, and I know it's on everyone's mind. Some colleges, some post-secondary institutions have mandated COVID vaccines for the fall. And this is not happening at the K-12 level yet. But do you anticipate that this may be part of the conversation in the future? And how do you balance kind of that personal desire and the personal wishes of a family with public safety and public health, and how does that look? And I know that's a really tough question, and no one has a great answer to it right now, but I'd just love to hear a bit about what you all are hearing and thinking about as this debate happens. And Linda, I'll start with you.
I mean, a year from now, we could see that states begin requiring, this vaccine. It's certainly not going to be this fall. But one issue that may come up this fall, I had a principal tell me that no, they can't ask, if a child is vaccinated, but they want to make sure that for quarantine purposes that parents have an option or have a way to notify schools, if their child has been vaccinated, because that's going to affect if they were exposed to somebody who tested positive, whether they have to quarantine or not. I think one of the things that came up this year was why students wanted to remain remote was so they could keep playing sports and not have to quarantine if they were, exposed. But in the fall, there may be issues around, class trips or field trips or things that students want to participate in again, and vaccination, could play a role in that.
And one thing, and I noticed the question about ensuring that parents and children who don't want to be vaccinated, right, don't feel additional undue pressures. And I actually want to address that one. I think in the context here, a lot of this is about making it as available as possible to those who want to have the vaccine. Now, I have a personal opinion. We all probably have personal opinions about whether or not that's good, bad, or otherwise. But forcing, that kind of into a conversation about who wants it and who doesn't. And I'll give a, just even in my own experience with my own kids who were, when 12 and up hit, the school actually did a vaccine clinic, but because of that concern about being over pushy, there was not a wide availability of understanding that it was even, or wide understanding that it was even available. And so I think we got to be able to balance those two things. And I appreciate, just like we've had on mandatory vaccinations overall. I mean, I think schools have done an amazing job of understanding the rights of parents and managing those particular rights. And again, I just feel like those local conversations between parents and schools is the most effective way. I mean, if I was to mandate something, so to say, from a statewide perspective, I don't think we would have done as well as we did by letting people really understand, give guidance, and provide that ability. And I feel the same way right now. There is substantial portions of the Nebraska population that might push back on vaccination or mandatory vaccination, but a lot fewer that will push back on having vaccine available.
I would agree with the commissioner, and certainly with Linda's insight as well. In Orange County and in Florida in general, we don't see a path that would make the vaccine mandatory. Additionally, because we have student privacy rights that are of concern, no one should know if you decide to wear a mask or not wear a mask. No one should know whether or not you've been vaccinated. So there's no ability to try to somehow disaggregate the student population or to make someone feel pressured. So I may be wearing a mask because I have an additional health issue and I want extra protection, but I've also got the vaccine. And so we have no intention, nor will there be a way for teachers or other employees to determine who's had the vaccine and who has not. What we are committed to is making sure we share information and, as the commissioner said, make that vaccine very readily available to everyone who is interested in it, whether they take it at school or at home or after school hours when their parents show up. All of those options we want to have available. And honestly, we will say, and our board has had a statement that says, you need to consult your own physician if you have, particularly if you have health issues or you've not been vaccinated yet, then you need to consult your physician regarding using a face mask and regarding the vaccine. And we leave that up to individuals. And I would hope, my guess is most of my peers across the country have no intention of identifying students or making them feel somehow pressured. I mentioned the lottery for a partial scholarship. I heard of a district doing that. I'm not aware of that being a large practice across the country, but I do believe we'll have to have some incentives that at least make people strongly consider the possibility. But again, then not being able to identify those who've gotten their shot elsewhere. You don't know who's standing in line versus who got their shot at their doctor's office. Hopefully pediatricians will be dealing with it very soon. And so we believe that anonymity should at least keep students from somehow being disaggregated. Information being key. Information and availability.
Thank you. And I think you all did a really great job of framing that as this is about access and, making sure that anyone who wants access to the vaccine gets one, which I think kind of leads nicely into my next question, which we've touched on a little bit, but I'd like to dig in a little bit more. We've touched on rural communities and healthcare access in general, and not just in rural communities, but really with many communities, healthcare access is a real concern, regardless of COVID vaccines or not. And so we've also said that schools are a really important part of the community. And so looking forward, thinking post-pandemic, 10 years from now, we've all blocked this from our memory. And what do you hope that we can take from this to ensure that schools are really working with our healthcare systems long term to make sure that students are getting access to the care that they need, and that, but while still respecting, the student data and student privacy. And I think that's a conversation that's going to become very important over the next few years, and I'd love to hear some of your thoughts on that. And Commissioner, I think we'll start with you, and then Linda and Dr. Jenkins, if you want to jump in, would love to hear from you too.
Yeah, and just I guess I'll call it full disclosure. I was, born and raised in a very rural part of Nebraska, and access to healthcare continues to be a substantial issue for many people across the state. Even, we were very worried about obviously hospital capacity in the midst of the peak that was taking place. I live in a community right now of about 3,000, which is huge compared to where I grew up, which is probably currently about 300 people. Um, Access, my dad came down with COVID, by the way, kind of in October at the beginning of the peak. I joked with him like a son would with a father, right? About you let your guard down, and he was taking it very, very seriously, but he went and visited a cousin and got it in that setting. I was doing work, understanding what the risks were at that moment in time, but like ambulance care is dependent on, all volunteer, and that's not unusual across the country relative to that type of service. They had to be prepared for dealing with COVID cases in that earliest time. My dad's one of the younger guys in town, I would call it, in my little hometown. And you have, and I say that, and he's in his 70s, but the reality is they take care of their elderly neighbors. And I just think one of the dynamics for the school's role within that point in time was understanding where were we at. But again, the folks that provide, kind of that first responder care in a lot of communities are tied to the school as well. And so my dad ended up being taken by ambulance to go to a hospital that was 30 miles away. His doctor is 80 miles away where he actually goes to the doctor. They took him in, said, we're not really going to treat you here. Here's the steroids, and sent him back. And luckily he wasn't their worst case, and he responded well to that. But that's a pretty dang typical story in rural places for healthcare. There wasn't someone else for him to call other than the ambulance to get to a doctor or get to that setting. In rural places, our kids aren't necessarily having regular doctor visits with their pediatricians. It's mostly general practitioner kind of driven environments. And they don't live in those communities even, right? So I think we have to constantly think about what's the role of the schools and accurate information. We have very few school nurses in rural Nebraska. We have very few. So we're really looking at how that needs to be expanded for the future. Quite a bit of telehealth, was expanded in this time. And I think that's actually one of the good stories of things that happened during the pandemic. But, I think for me anyway, reflecting on, I know what that environment's like, and you kind of get used to it and you deal with it. But in the course of a pandemic or any other type of crisis that takes place, you really see the holes in that. The holes for those rural communities are, we have rural communities with historically marginalized populations. We have rural communities with highly vulnerable people. We have all those same things, and yet really thinking about how we can use schools with their public health has been just a huge part of filling gaps, and continuing to do that's going to be important for every community.
Oh, go ahead.
I would add, I think the relationships established will continue. Dr. Pino and our local Florida Department of Health here in Orange County has been a phenomenal partner. And I think, I certainly believe that those relationships will continue, and that we can provide assistance to our communities. Flu vaccine clinics, for example, we were looking at prior to the pandemic, and now it will be a regular occurrence for our schools. So I think the relationship with our Department of Health has certainly been enhanced and magnified in its importance in the way we work with and serve our community. Secondly, I think those ESSER dollars have been extremely helpful, because we are, from the initial CARES funding, we've actually hired an organization that provides RNs for our schools. Couldn't have afforded it without. We have health clinic attendants who are basically classified personnel who administer medication that might be scheduled for children that have to come to the clinic to receive it, or they let a sick child wait there until their parents pick them up. But now all of our schools have registered nurses, and then they have an additional clinic attendant that can watch someone who's just there to get their regular medication or waiting for mom to pick them up. But the registered nurses can provide additional assistance. And we've had a pilot going with telehealth with those clinics. So the nurse can actually deal with the doctor and coordinate with the parent to provide additional healthcare needs. So those two come to mind right away that I think without the pandemic, we may not be seeing that kind of flexibility. I think several other things will change in years to come because there's no need of rushing back to normal, because we tell folks all the time, normal was overrated. Wasn't working for everyone to start with. I don't need to fly to Nebraska to meet with the commissioner. I can certainly do a Zoom call, save money, be more efficient, and save the wear and tear on the bodies as well. And so I think so much of what we've learned, we have to take advantage of and just be determined not to have this stampede. That's what one of my colleagues called it, the stampede back to normalcy. It's not the direction to go. We have to take advantage of the digital learning that we've had to put in place. Need to take advantage of that and not move backwards on that. And we certainly have to take advantage of some of the medical advancements like telehealth.
I was just going to mention that the Biden administration has proposed a huge increase in funding for community schools. And, I was thinking and wrote about this a while back that, because of the partnerships that have been formed during this time and the needs that schools have recognized within families, schools that maybe never considered operating like community schools in the past, might be more open to that model now of, having on-site healthcare or, stronger relationships with community organizations to deliver, whether it's, mental health services or other, on-site programs, using those schools as a hub, for services. So that's an idea. I mean, obviously there's already strong models of that around the country, but it's certainly an idea that more might consider going forward.
And I might just, go ahead, Dr. Jenkins.
We have some community schools here where the health clinic is actually there on site, health and dental, social work services, all of those wraparound services actually available on site. We've got 3 sites currently looking to expand it. It's an expensive model, and I'm very hopeful that there'll be funding that spreads it far and wide.
And I see the same thing in Nebraska, and trying to come up with almost virtual community school supports as well in some of our smallest communities. Our Native American communities, where we have 3 different tribal reservations and that are actually very remote and very small communities in of themselves. And we actually, part of the broadband efforts in the midst of the pandemic was to ensure that they had broadband to home to deal with remote learning and remote health, and create those types of connections. And so there was actually really exciting things that got done in that period of time that will have long-standing, benefits, I believe. And I think it's important for us to think about all of those things coming together. I really like your point about normal is not that great. Let's not go back there. And so I think for us to continue to think about some of these investments that I think we're going to, change our normal practices and hopefully better serve our children and families across the state is just, I think, a great moment in time that we can reflect back on, where I don't want to forget everything that happened, Julie, from this past year. So.
Yeah, selective blocking of memory. I think those are all such great points, and unfortunately we only have about 5 minutes left. And so to kind of close us out, I would love for each of our panelists to take maybe just 10 seconds and think in your head about what a year in, as we're starting to kind of see this goal line and say what gives you energy and what gives you optimism around these conversations around community partnerships, around getting access to healthcare for all students, around getting access to high quality educational opportunities for all students. What is really driving you right now, and what excites you? And I think you all started to kind of touch upon this at the end, but I'd love to hear kind of in your own words, really what is getting you going. So we'll do kind of a quick round robin, maybe 30 seconds to a minute for each of you. And we'll start with Linda and then Dr. Jenkins and then close out with Commissioner Bloomstead.
Well, as a reporter, I mean, I've actually always enjoyed complex stories that involve, multiple partnerships and they can be, more challenging. I mean, I'm certainly, I never had the kinds of sources of epidemiologists before. And, I mean, this year has, certainly opened up, from an education writer's perspective, different people that we need to be talking to going forward. And it's certainly informed what we've written about.
Thank you. Yeah. And Dr. Jenkins, how about you?
A couple of things come to mind. First, I alluded to it. I think there's so many things that we've learned that we have to take advantage of. I saw a question in the chat about what if there's another surge? Well, we know we can pivot to digital learning when we have to. If it's diagnosed, if there's contact tracing, we can be surgical down to the classroom level or an entire wing or an entire school. If we have to pivot, we don't close school, we pivot to digital learning. It may not be the best for all of our population, but it's better than having to shut down and not having any instructional time. Secondly, I look forward to this notion of being liberated from some of the pandemic restrictions that had to be in place. People call it face mask revolution or face mask liberation. I certainly want to see those kind of things go away as well. But I think what we have to keep in mind is this may not be the last time we have to deal with a pandemic or any kind of infectious disease that is highly contagious. And I think what is reassuring to me is that we got through this year without doing great damage to our children in the instructional setting and without having absolutely no learning take place. We've had limited learning loss, we know, for particular populations, but at least now we have a plan. And should we need to do it again, I think our community would be ready to respond much more swiftly and probably much more effectively.
And from my perspective, I feel like we're going to be in a better sense of readiness for a lot of different things, for the relationships that we do have across public health. And I did see that question too about what if there's another surge, which is a real concern. But in fact, a lot for me is thinking about what are those capacities that we always have to have in place now to deal with that, and how can I help scale that out from a statewide perspective relative to ensuring that schools don't burn all of their time and energy preparing individually for that. How can we actually be more assistive? And I think that relationship from federal government to state government to local government is really quite critical. And so figuring out those balance points right now is, I think, very important. I mean, ultimately, in the end, we can't educate students as effectively if they aren't healthy and able to attend on a regular basis and be able to be engaged and successful on a lot of fronts. I think the other maybe last point is a realization about maybe for the public at large, the importance of schools in the whole economic scope and the importance of that across the country, and ultimately that we have to continue to do this background work to serve students' whole needs, and that's different than I think we get focused sometimes on about academic needs, and those things intermingle, and we can only do that as a community and as a country really effectively together.
Thank you so much. And this has been a really interesting discussion today. I've really appreciated this entire conversation. So thank you again, Linda, Dr. Jenkins, and Commissioner Bloomstead for all of your insights. And I feel like I came away with a lot more context around these discussions than I had before. Just a couple quick notes as we are wrapping up. There we go. A few upcoming webinars from the Hun Institute. On Thursday, we have our post-secondary pathways webinar with supporting Hispanic serving institutions. On Tuesday, June 15th at 1 p.m. Eastern, we'll be discussing Indigenous education, past, present, and future, which I think will be a really great conversation and really encourage you to attend. And then finally, on Tuesday, June 22nd, we'll be discussing the politics and policy of inclusive K-12 social studies curriculum. So all three of these really relevant topics, ones that are coming up a lot in public discourse right now. So really encourage you to tune in and hear from some great experts who are going to provide some background there. And then any other webinar opportunities that you might be interested in from the Hun Institute, please feel free to visit our website. We have usually about at least one a week. So we've got something for everyone. Once again, Linda, Dr. Jenkins, Commissioner Bloomstead, thank you so much for being here. Thank you so much for your insights and your thoughtfulness. And thank you to everyone else who was able to listen in and submit your questions and join into the conversation. We're really grateful for your engagement. With that, have a great week, and we are looking forward to seeing you next month on the next installation of Homeroom with Education Leaders. Thank you so much.
Thank you.